means tested. For instance, if you work for 40 years in a job like yours or like mine, you're gonna need different health care benefits. I would say, on the whole, when you get older, as somebody who worked construction for 45 years. Okay, it's just different. Their knees and backs, given everything else being equal, those folks' knees and backs are going to be a lot worse off than ours are, because we spend time typing on the phone, writing, doing things that aren't manual labor. But I think we have to look at the health care for those types of folks and health care for folks that don't do manual labor and say, well, your needs are going to be different. Everything shouldn't be the same. And if you have the option, for instance, to get health care through your private company, but you choose instead to have Medicare, I just think we have to look at those things. Medicare is supposed to be a safety net for those people that can't afford health care or aren't able to get it when they hit retirement age. And we have to make sure that the people who really need it are getting it. And I don't know, we might have to look at the people that don't really need it. Now, the big problem with that is you have to determine who gets what, right? So that's going to be a big discussion. But in the big sense, that's some places where I would modernize. So I think you have to look too at taking the government out of it. When you talk about Medicare, it's the government creating a healthcare marketplace, because the government, the federal government, takes taxpayer dollars and directly inserts it into the healthcare marketplace for those folks that are receiving Medicare. So the government's literally creating the market in this case. They're giving the money basically to the people that are on Medicare. Then they also prescribe the services, and they tell the Medicare providers, here's what we, the government, are going to give you to provide those services to the people that are on Medicare. If you pull the government out of this a little bit, and let's just make this really simple, and this is just an idea, I'm not saying that we should do this, but let's just say you give every Medicare beneficiary, and I think we figured out yesterday there was about 48 million retirees at this point, right? People 65 and over in the country. That's going to jump as baby boomers retire. But let's just say 48 million. I could be off by a few million. Okay. 2011 numbers. So 48 million. Let's say that you give each one of those people $500 a month. Okay. You've now created a marketplace, and let's say that you pull all the Medicare rules out of it, and the government just says, here's $500 in your health savings account. This is your Medicare. Okay. The way that the free market works is you're going to have companies look at this 48 million times $500 a month. That's a lot of money. I'm not sure what that comes out to monthly, but it's a lot of money. You're going to have private companies vying to provide the services for those people for $500 a month. And I guarantee you they will do it more efficiently and effectively, because the people that are getting that $500 a month in their health savings accounts are going to be able to pick and choose where they want to go, what services they want, etc. So I think there's other ways to do this that use the great market system that we have while still having regulatory controls on it, so that there's no abuse and there's no fraud, and people aren't being taken advantage of.